Hello and welcome to the Daily Blu. I'm your host, Donna Drake, and with us in the studio today is Dr. Grace Hsu. Welcome to our show. How are you?
I'm doing good. Thanks for having me today.
Now, you're a recurring guest. I know that you've been here a few times now on the Daily Blu, so welcome again.
Yeah, thank you. I'm getting more used to it.
Well, we love
Still
having
nervous?
you. We love having you here because when you come, you always have such great information for our viewers. And one of the things we're going to talk about today is periodontal disease.
Absolutely.
It's a big word, but what is it? What is periodontal disease?
Periodontal disease is actually a gum disease. Basically, it's a bacterial infection that affects the gum tissue inside the mouth. And when it occurs and allowed to be staying there too long, then your bone basically want to run away. That's resulting bone loss. Therefore, what people call, oh, my teeth are loose, my teeth are getting loose, or my teeth are start to displace and grow into funny places, funny positions.
Huh. So if you see, like, if you're at home and you see like your tooth shifting or something like that, you should get into a dentist right away.
Absolutely, right.
Okay, because it could be a more serious effect than just your growth pattern.
Well, yes, because once we grow into adults, the teeth should really not be shifting that much.
Okay.
And there could be many factors, but I think having a regular cleaning checkup really will be helpful to rule out.
Now, if somebody has halitosis, like really, really bad breath,
Right.
could that be caused by periodontal disease?
Absolutely.
Okay.
One thing very simple, anybody can do this at home. When you floss at night,
Right.
make sure nobody else is looking at you. Smell at once what is on that floss, then you know where halitosis come from.
Really?
Of course, that can also be associated with other factors as always, such as stomach problem. If there is a foul taste coming up, the mouth could still bad, but really a lot of it has to do with what's stuck in there.
So now, do you recommend that people brush and then floss, or floss and then brush? Which step comes first?
I'm happy if somebody does floss and brush, however way, but to get the best effect, my personal opinion is I prefer a person to floss out the debris out in between the teeth, then use a brush to gently wipe away those debris.
Okay.
So the mouth is left nice and clean.
Because I think a lot of times people have it backwards.
Yes.
Right? And I don't think,
so too.
I think that sometimes you just need to re-educate people, to
Absolutely.
floss first.
Absolutely.
So,
I think it's great that at our practice, for whatever reason they come in, we like to shoot for the basic cause of the issue and solve the problem at the base. Because I'm a doctor, I'm not a tooth technician, so while I could fix out the tooth very well or fix out a particular disease well, I would like to empower the patient with the knowledge. And I really believe if a person knows what I know in my head, there's no way people don't go home and do what's the best for themselves. It's a positive life change. Lifestyle change is a positive one, and resulting after the rest of life not repeating the same treatments, which is great.
and I have another question too before we talk about how you diagnose periodontal disease, and that's a toothbrush. A toothbrush comes in like a soft, a medium, a hard. What's the difference between the three toothbrushes? And is one more, is one better than another one, like firm? Like I know a little child uses like a very soft brush.
Absolutely.
Okay, so does that depend on your teeth, or how do you
Quite
decide?
My own opinion on it, I think the only toothbrush should be sold on the market should be soft or extra soft. However, unfortunately, years ago, I'm talking about maybe 20, 30 years ago, there was other method that required people to take a hot brush, go at the gum line, and turn a particular way, and that had resulted in a lot of damage to the teeth. But the people that use a hard brush are loving the hot brush so much, the manufacturer don't want to take it then off the market. It's a big business.
It's a big seller.
Right, right. And we as practitioners, we are not the big, consumer companies. We're here to tell our patient what's the right thing to do. And that's the only type of brush we buy from our own patients.
Okay, so floss first and then follow up with a soft brush.
Absolutely.
Excellent. So now how do you diagnose periodontal disease? When you're looking in somebody's mouth and they have the halitosis, and how do you know that they might have gum disease?
It goes back to a very, very simple and basic test. So everybody had experience full gas duct and take a floss and clean that space between the teeth and the gum. That's the space we measure. I take a very simple ruler and measure the space and for the whole mouth, and which should be a part of regular routine checkup exams. And any number that's more than 4 are not healthy numbers. When it gets to 5 or 6 and more, it's actually a moderate gum disease and traditional calls for non-surgical treatments.
Okay.
Nowadays, there are a lot of different ways to treat it, though.
There are. Okay. So like when you're measuring, you're going to see how much distance it is from the top of the tooth down into the gum. And if you're getting to like a 4, 5, or 6 measurement, then you know there might be some problems with.
Absolutely.
Okay.
And just like any chronic disease, the key of the treatment success is to catch it early, change your lifestyle, or change whatever is causing it, remove the toxin that's stuck in that space that caused all that disease, and then send the patient on to recovery road, hopefully.
Now, can antibiotics, you were saying it's a bacteria sometimes that causes the periodontal disease. Can you sometimes treat it with antibiotics or medication?
Absolutely, yeah.
Okay.
There is a medication with many generations developed. And in my office, we use Atrodox, we use Arestin, different things. Basically, is a high dosage, which is of tetracycline, to use as a bomb to bomb out the bacteria that cause the disease. That's in conjunction with removing the toxin, which is the calculus, the tartar buildup, and that's what we call deep cleaning. And I can also use a laser, and now to direct the laser energy into the same disease pocket to, so to speak, decontaminate pocket. It really is to decrease the bacterial counts. The last bacteria there is left surviving in the pocket, and the better the home care is, the more chance one's immune system will go to work, and then ultimately brings that person back onto the recovery road and
now,
keep that person healthy.
Once you've lost gum, does your gum regenerate?
Unfortunately, no.
Okay. So once it's gone, it's gone.
Yep.
Okay.
We're blessed with what we got, and that's it.
Now, you're also saying sometimes that it can actually go all the way deep into the bone, and it can affect the root of your teeth, and that's why sometimes people have tooth loss.
Right. Just like after Sandy a couple years ago, a house with the foundation washout could start to lean, and that is the reason a person with severe gum disease will start to lean. And normally that's not a good sign to wait for that long. Just like a heart disease or diabetic, people don't wait until they have a heart attack and say, oh, yeah, I didn't know I have a heart problem. So people basic blood pressure check, things like that, and that's what is equivalent to our basic readings.
And I also know, because I've interviewed people in the past before about heart disease, you mentioned heart disease.
Absolutely.
I know that having a clean mouth is also very preventative for heart disease.
Yes.
Because there's a link, they said, between your gums and periodontal and heart attacks.
Yes.
So it's important to brush your teeth.
Absolutely.
And to floss.
to floss, brush, and get your dentist give you a good checkup for.
Excellent.
Yeah.
Now, you were one of the first dentists. You're leading and trying to do non-invasive procedures. Can you tell us the difference in treatment between a non-invasive procedure and an invasive procedure?
Sure, no problem. I was trained actually doing surgical gum treatments. Basically entails of if a person has a gum disease, we take a scalpel, lay the gum tissue off, so we can look at the bone and look at where the bacteria is, things like that, and clean it off and suture it back up. And my own family member had taught me what a normal person think and really dislike that. And therefore, in a mission of really want to help people to feel better about themselves and then in a process getting help, I had learned how to use a laser to decontaminate the pocket, and how to use, like what you said, the antibiotic to bomb out the bacteria. I also use a particular 20 milligram tetracycline to decrease the reaction from the body that sets off the reaction into the gum disease. We also do the deep cleaning, which is the non-surgical maintenance on it. And of course, we always have to be realistic and diagnose the patient correctly from day one and let them know what they're really in for and develop a plan. Because it's as much as what I can do, it has to require the patient's cooperation and requires motivating the patient to do what's right for them, or know when the patient's not ready. The patient's not ready.
And talking about motivating, one of the reasons we love having you on the Daily Blu is that I feel like the audience is being motivated to go home and just brush their teeth.
Oh,
I know, like the second I'm done talking to her, I'm like, okay, I want to go scrub right now. But it's important. And what you do is you're saving lives. And we've talked about that. And it's Long Island Dental Spa, right?
Yes.
So how could somebody reach you? What's your phone number, Dr. Grace?
My office phone number is 516-922-5740.
And it's lidentalspa.com. And you're in East Norwich.
Right.
Okay.
I'm in East Norwich.
But you treat people from all over. A lot of times people come in from, you said Vermont and from all in New Jersey.
Yes.
So, but
people from Europe.
Oh, wow.
That's original New Yorker, but they live in Europe, and whenever they come back to New York, they come and visit me.
That's excellent.
Yes.
So thank you so much for being here, and we would love to have you back.
Okay.
Many different topics, because the mouth is such a diverse place.
I
so
think
it's important to learn about it.
Thing.
It's
Yes.
fascinating. Thank you so much. I'm Donna Drake with Dr. Grace Hsu. Stay tuned for more on the Daily Blu.